Order. We start with questions. Secretary of State for Health and Social Care, Rosie Duffield.
She's not.
Not here. We then go to Richard Burgon.
Question number 1, Mr. Speaker.
Happy St George's Day, Mr. Speaker. Cutting waiting lists is one of the Prime Minister's top priorities. We are spending more than £8 billion on additional elective activity, investing in additional capacity, including community diagnostic centres, one such centre being in the Honourable Member's constituency. Since September 2023, we've seen overall waiting lists fall by almost 200,000. That's the biggest 5-month fall in over 10 years outside of the pandemic.
Richard Burgon.
Thank you, Mr. Speaker. NHS waiting lists are up threefold since the Tories came to power, and the Prime Minister's pledge to cut waiting lists is in absolute tatters. Rather than taking responsibility, the Tories first blamed NHS staff trying to get better pay, and now they've opened up a new round of media attacks on the sick and the disabled. So why doesn't the government instead go after the tax dodgers, as Labour plans, to raise funds and help solve the crisis in our NHS?
Well, the honourable gentleman once again doesn't condemn the strikes, and I would just gently say, whilst we are getting waiting lists down in England, Welsh Labour has the longest hospital waits in Great Britain, putting patients at risk because they do not have a plan to clear the backlog. In December 2023, the Welsh Labour Party had the highest number of patients waiting over 2 years for treatments in Great Britain. It is an outrage, Mr. Speaker, and yet that is the blueprint that the Labour Party say that they're going to implement here in England.
Simon Fell.
Very much, Mr. Speaker. I'm seeing increasing numbers of constituents coming to see me in surgeries at the moment about chronic UTIs, not for the women coming to see me themselves, but for their daughters. Unfortunately, there seems to be no treatment pathway for chronic UTIs amongst girls. I wonder if my friend the Minister might have some thoughts on this and agree to meet with me to discuss the issue further.
Thank you, Mr. Speaker. I would be very happy to meet with my honourable friend to discuss this issue.
Right, can we now come to Shadow Secretary of State West? Reaching.
Thank you, Mr. Speaker, and happy St George's Day. Westminster is awash, Mr. Speaker, with rumours that the Prime Minister is going to call a July general election, presumably to avoid giving his Rwanda gimmick the time to fail. So I have a very simple question for the Minister. Will he repeat the pledge the Prime Minister made last year and promise that NHS waiting lists will be lower at the time of the general election than when the Prime Minister came to office?
Minister.
The Prime Minister has been very clear that getting waiting lists down is one of his top priorities, but he has also been clear that performance has been disappointing. One of the reasons performance has been disappointing, Mr. Speaker, is 1.4 million procedures have had to be rescheduled because of industrial action. So I would gently ask the Shadow Minister whether he condemns those strikes.
Number 2, Mr. Speaker.
Sorry, 3, Mr. Speaker. The General Medical Council has been constituted by Parliament to ensure decisions about individual doctors are independent of both the profession and the government of the day. The Professional Standards Authority oversees the work of all United Kingdom's professional regulators and reports to Parliament on their operational performance. Parliament continues to set and oversees the principles and scope of the regulator's powers.
Governance means having or ensuring that there is transparency, and one of the concerns of some of my constituents is whether or not you can appeal GMC decisions. So in light of that request, can I ask the Minister to come back and reassure me that we can have better transparency in the GMC on the decisions that they make?
I thank my honourable friend for that answer. The GMC and other professional regulators have a statutory duty to investigate any concerns about the fitness practice of one of their registrants and to take appropriate action to protect the public when that's needed. The regulators are overseen by the Professional Standards Authority, which has the power to appeal cases where, in their view, a sanction imposed by a regulator is insufficient to protect the public.
Shannon.
Speaker, can I thank the Minister for that answer? GMC have 7 principles of decision making and consent, so how can the Health Minister ensure that GPs can fulfil their obligations when the time constraints for appointment means they physically don't have time to listen to every complaint? And people really have to book a double appointment to talk about more than one issue. So what further support can government give to GPs to enable them to fulfil their GMC ordered standards of care? Thank you so much.
Well, as the honourable gentleman will know, this government has committed to delivering 50 million more GP appointments and to make it easier to see a doctor across the country. In England, in December 2023, we delivered 25.77 million GP appointments compared to 23.31 million appointments in December 2019, an increase of 2.46 million appointments each month. So we need to continue to work with programmes like Pharmacy First and other steps we're taking to reduce the pressure on GPs so they have more time to spend with their patients.
Vicky Ford.
4, please.
Thank you, Mr. Speaker. Can I say GPs are the rock? They are the absolutely underpinning force behind primary care, and I want to take this opportunity to really pay tribute to them for all that they do for the health of the nation. And my honourable friend is absolutely right to raise the issue of GP retention. We know that during COVID and since, GPs are exhausted. We know that the return to primary care provision has been difficult. There's a lot that the government's doing, including improving digital telephony, reducing the administrative workload, and I'm about to launch a Future for GP Practice task force to look at what more we can do to provide more support to this critical part of our primary care.
Vicky Ford.
Thank you, Mr. Speaker. Chelmsford is a growing city, and it's very good that compared to pre-COVID we have more clinicians in our GP surgeries now, but we need more surgeries as well. We have one new surgery being built, but I have been told that the limits imposed on NHS lease costs by local district valuers make it increasingly difficult for developers to deliver these new surgery buildings, not only in Chelmsford but in other parts of the country. Will she meet with me and other affected MPs to see if we can resolve this issue and help growing areas where we have more houses also deliver the new surgeries that we need?
Well, of course, I'd be delighted to meet with my honourable friend to discuss this issue, which has been raised with me by a number of other colleagues across the House. She will appreciate that the District Valuer Service is vitally crucial in ensuring value for taxpayers' money from the rents that are charged for GP practices. But nevertheless, the department is working very hard to support better primary care facilities, and I do understand the point and will be very happy to meet with her.
Thank you, Mr. Speaker. There are 56 fewer fully qualified GPs in Somerset now than in December 2016. So it's no surprise that my constituents in Wincanton feel that they are never able to access one. So how will the Minister support general practice to continue to provide the vital services that are for our communities that they deserve?
Well, again, I'd first like to say how fantastic it is that hard-working GPs have delivered 60 million more appointments a year than there were in 2019. That is an absolute credit to their efforts. What the government has been doing, as I say, is a wide range of different approaches to try to reduce the administrative burden. We're focused on trying to deal with some of the issues GPs have raised with me around primary-secondary care interface, so that they're not having to write all the fit notes, to liaise with consultants. We've spent over 200 million on digital telephony, and very importantly, the additional roles reimbursement scheme has added over 36,000 more professional staff into GP practice, from physios to pharmacists, to try to support access for GP practices for patients.
Shannon, Mr. Speaker.
Yeah. Thank you, Mr. Speaker. At the last general election, the government promised to deliver 6,000 more GPs by 2024-25, but there are still 2,000 fewer GPs than in 2015. Part of the problem is morale has plummeted over the past decade, meaning experienced family doctors and newly qualified GPs are hanging up their stethoscopes. What does she say, having scrapped 2 GP retention schemes last month, and will she come clean today on another broken manifesto promise?
Well, the Honourable Lady is choosing numbers out of the air. She will be aware she will be aware that there are almost 3,000 more GPs now than there were in 2019. And very importantly, the long-term workforce plan is scheduled to introduce 6,000 new training places by 2031-32. And in 2022, we had the greatest number ever of new trainee GPs. That is great news for GP practice, and they are absolutely crucial to primary care.
Mr. Speaker, may I wish you a happy St George's Day and also wish the Honourable Member for Bristol South a speedy recovery. I hope to see her across the dispatch box soon. The Government has invested significant sums to maintain and modernise NHS buildings, including £4.2 billion to integrated care boards this financial year. This is on top of the expected £20 billion for the new hospital programme, and we've invested a further £1.7 billion for over 70 hospital upgrades across England, including Mid and South Essex.
Speaker, I thank the Secretary of State very much for the Government's commitment to delivering the £110 million in capital funding for South Essex hospitals, and for her recent visit to Southend Hospital, where she saw how £8 million in our emergency village can do, how much it can do in the hands of Southend Hospital's Inspiration NHS staff. However, our ageing buildings do also need urgent maintenance. So what can she also do to deliver the £38 million in maintenance funding also needed for Southend Hospital?
Well, may I thank my honourable friend and, in fact, wish her the very best of luck, because she is due to abseil down the hospital next month for their radiotherapy appeal. And so I very much hope she lands safely and does not trouble Southend Hospital. But I was delighted to visit the hospital at her invitation earlier this month, and I was very much impressed by the immediate improvements that the £8 million of funding in the Dorset ward has meant for the discharge and the treatment times through accident and emergency. And this is part of our plan, both through the urgent and emergency care plan, but also our recovery plans for electives and for the new hospitals programme, to rebuild to rebuild hospitals and to give that investment so that clinicians can use it to treat their local patients.
Thank you, Mr. Speaker. Last month, I met the Chief Executive of Stepping Hill Hospital in Stockport. She informed me that the primary outpatient building, which provides 85% of outpatient capacity, was recently condemned. While funding has been secured to build 2 additional wards, this will not be ready for at least 15 months, causing huge disruption in the interim. 14 years of underinvestment has left Stepping Hill Hospital quite literally crumbling. Will the Government provide urgent capital investment for Stepping Hill Hospital so that my constituents and our brilliant NHS staff can have the facilities that they need?
Well, I very much hope the honourable gentleman has already spoken to his integrated care board, because he will know that responsibility for local investment decisions rightly is at local level. But I can say that as a government we have very much invested in hospital upgrades, including £4.2 billion to integrated care boards this financial year. I hear the timetable he cites, but I would encourage him to go to his integrated care board to ask what more they are doing.
Number 6, please, sir.
It's vitally important that people have access to the medicines they need. The Department has been working with the suppliers of medicines used in the treatment of type 2 diabetes to seek commitments from them to address the issues, expedite deliveries and boost supplies. As a result, the position is now much improved from a few months ago, with new patients now able to receive these critical medicines. We continue to work with industry to address remaining issues as quickly as possible.
Anderson. Thank you, Mr. Speaker. We know that obesity in this country is costing the NHS about £20 billion a year, and it is a major contributing factor to type 2 diabetes, which in a lot of cases is preventable by a healthy lifestyle. So what more can we do to encourage people to eat healthily and therefore save costs within the NHS?
The honourable member raises a very important point. Obesity is linked to many health conditions, including type 2 diabetes. We are delivering an ambitious programme of work to create a healthier environment to support people achieve and maintain a healthy weight. This includes restricting the placements of less healthy products in shops and online, calorie labelling on food sold in restaurants, and a tax on the sugary drinks industry, which has removed the equivalent of 45,000 tonnes of sugar from soft drinks.
SNP spokesperson Kirsten Black.
Thank you very much, Mr. Speaker. A recent Nuffield Trust report shows that medicine shortages are a new normal in the UK. The Minister might claim that this is a global issue, but the report highlights that shortages are being made worse by Brexit. For example, the creation of a requirement for customs checks at the borders and leaving the European Medicines Agency have all disrupted the previously smooth supply of medicines. What urgent action will the Minister take to help tackle the disastrous effects of Brexit on UK medicine supplies?
Well, SNP, as usual, broken record. We all know that the diabetes medicine shortages is a global issue affecting countries not just across the whole European Union, but across the whole world, Mr. Speaker. Medicine supply chains are highly regulated, complex and global. Issues can occur for a multiple of reasons due to manufacturing difficulties, regulatory non-compliance, surges in demand, availability of raw materials, sudden spikes in demand, and issues related to the distribution of the product. But once again, as always, the grievance culture of the SNP is blame everything on Brexit.
Well, that's Hamilton.
Question number 7, Mr. Speaker.
Thank you, Mr. Speaker. We hugely appreciate the work that general practice nurses do, and I know that the Honourable Lady was herself a nurse in her previous life, for which I absolutely pay tribute to her for her service. Last year, she'll be aware that the government provided additional funding to general practice contract to uplift the pay by 6% in line with the pay review body's recommendations. We're very much aware that there is an issue with trying to make sure that general practice nurses do feel appreciated and are keen to be retained in GP practices. That's one of the reasons why I've launched a task force on the future for GP practice. And as she will know, it is for GP practices themselves to determine the pay uplift for nurses in their practices. And that's an issue that I'm looking closely at, because we know that sometimes that pay rise provided by the government wasn't passed on.
Thank you, Mr. Speaker. We have all seen images of people queuing around the block for an appointment at their GP surgery. And in my local ICB, there has been a decline in general practice nurses since June 2020. It currently takes 12 months to train nurses wishing to move into general practice. So could the Minister tell me and my constituents in Erdington, King's Standing and Castlevale what she is doing to ensure the retention of experienced nurses and the training of new nurses doesn't add to the pressure GPs are already facing? Thank you.
Yeah, the Honourable Lady raises an important point. The long-term workforce plan commits to increasing the number of general practice nurses by more than 5,000 by 2036-37. In her own area, the NHS Birmingham and Solihull ICB has seen the number of doctors in general practice between 2019 and 2023 increase by 134 full-time equivalent, but the number of nurses decreased slightly by 34 full-time equivalent. However, over that same period, direct patient care staff increased by 1,195 full-time equivalent. So I think that demonstrates to the Honourable Lady that the actual resources in GP practice are increasing, with specialisms such as physiotherapy, pharmacy, as well as nurse prescribers, to provide more access to patients for good health care.
Question number 8.
Thank you, Mr. Speaker. As the honourable member may know, in September 2023 we met our commitment to deliver 50,000 more nurses working in the NHS compared to September 2019. As of January 2024, there are over 68,800 full-time equivalent community nurses working in NHS trusts and other core organisations across England. That's over 2,000 more than a year ago. But we want to go further, and that is why the NHS Long-Term Workforce Plan sets an ambition to increase training places for district nurses by 150% to nearly 1,800. It also commits to improving retention within the NHS.
Thank you, Mr. Speaker. In Scotland, the vacancy rate for registered nursing posts in the community is 8.5%, and for registered district nurses it's 6.6%. In England, the situation is actually worse in most parts. that these posts are fundamental not just to care in the community and our communities themselves, but indeed to addressing bed blocking. Terms and conditions of employment are obviously for the Scottish Government to address, but the overall funding package is dictated by the block grant and by Barnett consequentials. Is it not time that the NHS was actually stood up for by this department? When we're seeing money for weapons abroad, why can we not provide care at home? We were told during the referendum that we'd be better together and the NHS would be protected. Instead, it's being undermined.
Mr Speaker, the members opposite love nothing more than to crow and to criticise whilst their health system declines around them, despite record funding from the UK Government. Scotland has, sadly, some of the worst health outcomes in the Western world. And earlier this year, when the UK Government stepped in to offer support, the SNP Health Secretary rejected that offer. Mr Speaker, I would reiterate once again, if the Scottish Government need help with reducing their waiting list, we stand ready to provide that support.
Abraham.
Number 9, please, Mr Speaker.
Thank you, Mr Speaker. We are committed to levelling up health, narrowing the gap in healthy life expectancy by 2030 and increasing healthy life expectancy by 5 years by 2035. This aligns with our mission to reform our health and care system to be faster, simpler and fairer.
Mr Speaker, in January this year, Professor Sir Michael Marmot published Lives Cut Short, which confirmed that between 2011 and 2019, 1 million people in 90% of areas in England live shorter lives than they should have, driven by political choices. And of course, this was amplified by COVID in terms of these inequalities. These lives cut short are matched by shorter lives in good health. Does the Health Secretary believe in evidence-based health? And if so, does she accept the overwhelming evidence that the levels of ill health we're seeing now reflects 14 years of escalating poverty, services run into the ground, including the NHS, and the failures of this government to do what it promised to do in 2019 to level up?
No, I don't. And I would just point to the legislation last week that this government brought forward, which is the largest and most significant public health reform we can make to help the constituents in her constituency and in other parts of the country that face inequalities, because we know that smoking rates are disproportionately higher in poorer communities, and that is one of the many reasons why we have brought forward this landmark legislation. It's just a shame that the Labour Party felt they had to whip their side in order to get their MPs to vote for it.
Will the Secretary of State give support to the Breast Cancer Now campaign to improve the uptake of breast cancer screening, particularly amongst women in minority ethnic communities, because this is a good way to tackle health inequalities?
I completely agree, and indeed further on the issue of ethnicity and inequalities, not only have I prioritised women's health as Secretary of State, but I have within that already announced £50 million worth of research into maternity disparities for women of colour, because we know that there are some very, very worrying statistics with that. And what is more, I've responded to the calls from brave constituents brought forward by honourable friends across the House to further research into lobular breast cancer, because we know it's responsible for some 15% of diagnoses, and yet we do not yet have the research or the evidence to help those women affected by it.
Imran Hussain.
Thank you, Mr Speaker. The reality is, if you live in the inner cities of the Bradford district, you are likely to live 20 years less than those that live in the more affluent parts of the region. Now, that just hasn't happened. It's happened because of 14 years of underinvestment and cuts, not just to our NHS, but to our community services. So will the Minister just admit that they frankly couldn't care less about people from places like Bradford? Because if they did, they would have accepted my levelling up bid, which would have addressed this injustice at its core.
Well, I'm so glad that the Honourable Gentleman has mentioned levelling up because presumably as part of his bid he will know that the 12 levelling up missions are mutually reinforcing, and so we take an approach on this side of the House that in order to help people with their health, he's shouting at me, to help people, I thought this answer would be important to his constituents. Yeah. So with levelling up, it isn't just about health, it's about the impact, for example, of education, of housing and other matters in our environment, which is why in the forthcoming major conditions strategy, we will be tying together these conditions that have the most impact on a healthy life and drawing together a cross-government strategy to help people living with those conditions live longer but also healthier lives.
Patel.
The Secretary will know about health inequalities across the east of England, including in Malden District, which will only be made worse by plans by the NHS to close St Peter's Hospital in Malden if those plans proceed. So does my right honourable friend agree that the levelling up funding that has been made available to Malden District Council should be prioritised to facilitate investment in new localised health services so that these inequalities can be tackled?
I thank my right honourable friend, and she makes a really important point that the purpose of the Levelling Up Fund is to help local areas address what they need locally, rather than a diktat arising from central London. And so I would encourage her, as I know she will, to work closely with those local agencies, the council and others who will be making those important decisions, so that their Levelling Up announcement includes health as an integral part of her mission to improve the lives of her constituents.
Shadow Minister Andrew Gwynn.
But back in the real world, the record of the last Labour government was that we increased life expectancy by 3 years, but under her government, it stalled for the first time in a century, with people in, for example, Blackpool, expected to live 4.5 years less than the national average, the rest of the country. Is the Secretary of State proud of this shocking record? Or will people have to wait to elect Chris Webb in Blackpool South and a Labour government at Westminster to finally turn the tide on health inequalities?
As someone who is proud to go to school in Blackpool, I don't need a lecture from the honourable gentleman about what Labour has done to the town centre of Blackpool, but also the important work that Conservatives in Lancashire are doing to help communities such as Blackpool. In terms of the record of Labour, I would gently point out, as I try to at every orals, Mr Speaker, that the record in Labour-run NHS in Wales is lamentable. People are almost twice as likely to be waiting for treatment in the Labour-run NHS in Wales. That is lamentable, not a record on which to be proud.
Ilford.
Number 10, Mr Speaker.
The Honourable Member raises an important point regarding people with spinal injuries. It's vitally important people with such injuries receive care in the most appropriate environment to support their care and their rehabilitation. The NHS has developed a range of guidance on this subject, including NHS England's Excellence in Continence Care Guidance. In addition, NICE guidelines set out that care that patients with spinal injuries should receive, including a neurological bowel management programme.
Thank you, Mr Speaker. There is a clear need for a national policy on bowel care in NHS settings for people with spinal injuries. I have listened to patients who have been left feeling abandoned, trapped in a hospital bed without the basic dignity of being able to use a toilet, all because of a lack of training for nurses to provide the necessary support. Will the Minister meet with me and representatives from the Spinal Injuries Association to discuss how we can make this situation better and ensure nobody is denied this basic level of care?
Here.
Well, I pay tribute to the Honourable Lady for the work that she and the APPG have done on this issue, and I'd be more than happy to meet with them.
Thank you, Mr Speaker. Question 11.
Thank you, Mr Speaker. Just over a year ago, we set out a plan to improve urgent and emergency care, and the plan is working. At East Lancashire Trust, 78% of A&E patients were seen within 4 hours in March. That is 4.5 percentage points better than last year and the biggest year-on-year improvement outside the pandemic since 2010. We know there is more to do, and that is why we're working with the NHS on year 2 of the Urgent and Emergency Care Recovery Plan.
Thank you, Mr Speaker. I'm grateful to the Minister for that response. I'm also very grateful that she's agreed to meet with me and other East Lancashire MPs to discuss the situation of emergency care in East Lancashire. But could I ask her to go one step further, and perhaps her and even the Secretary of State for Health could come to Burnley to visit Burnley Hospital, meet with the Trust and see what more we can do at Burnley General, partly to reverse the disastrous decision of the last Labour government to close the A&E unit.
Well, I commend my honourable friend on his campaigning on this matter and other colleagues from East Lancashire. I look forward to the meeting that we're going to have to discuss the performance of his local A&E, and I thank him very much for the invitation to visit as well.
In Barrow.
I share an ICB with the honourable gentleman for South Cumbria and Lancashire. I wonder if the Minister would agree that one of the reasons why there are such problems in A&E waiting times is because of congestion within our hospitals overall, because of the number of people within our hospitals who are healthily fit to leave hospital but aren't able to have a social care package when they return home. 24% of all the beds in the Morecambe Bay hospitals are currently occupied by people who are fit to leave, but there's no care package for them. What plans has she got to address the social care crisis in Cumbria? And that will include increasing the amount of affordable housing so people can afford to live in the area, paying carers better and more, and having more intelligent visa rules.
I think that does stretch it.
Well, the honourable member makes a point that the performance of A&E depends on the flow of patients through hospital and our ability to discharge them. That's why, as part of our work on urgent and emergency care, we have indeed invested in supporting hospitals to discharge patients. We've been supporting social care. We have seen an increased number of discharges across the country over the last year, which has enabled hospitals to treat more people and has supported the improved performance in A&E that I mentioned earlier. We're continuing to work on that, and actually, of course, we support social care with up to 8.6 billion extra funding over 2 years.
Rosanna Allen-Carr.
Thank you, Mr. Speaker. Number 13.
Every day, our NHS staff do an extraordinary job for their patients, and it is vital that the NHS supports them in maintaining their mental health. The long-term workforce plan commits the NHS to support staff health, well-being, and asks ICSs to develop plans to support this. I am pleased that NHS England are reviewing mental health services for all staff to ensure that all staff in the NHS have the support that they need.
Rosanna Allen-Carr.
Thank you, Mr. Speaker. Fighting to save a dying child's life, telling families that their loved one will not make it through the night, and working desperately in substandard conditions. It will come as little shock that all of this takes a toll, and last year there were 6.4 million mental health sick days taken across the NHS. Instead of receiving support, Mr. Speaker, our NHS heroes have a Tory government that treats them with disdain and kicks them to the curb. So will the Minister commit to funding the NHS Practitioner Health Service beyond the next 12 months, or will the government just simply try to shut it down again?
Thank you, Mr. Speaker. Well, as an NHS community first responder who served on the front line during the pandemic and had to see people before they were admitted to hospital and say goodbye to their loved ones for the last time, and as someone who's dealt with cardiac arrests, I know the mental toll that working for the NHS or volunteering with the NHS can take on our workforce. Therefore, we do give a very high priority to this subject. The NHS People Plan sets out a range of actions to build a more modern and compassionate and inclusive culture, and includes much stronger focus on the availability of quality health and wellbeing support. It is right that we keep services under review, so I am not going to make a commitment today to continue funding something we have agreed to fund for another year whilst these services are reviewed.
Rainbow.
Number 14, Mr. Speaker.
We are focused on delivering our women's health priorities for 2024. Recent successes include new women's health hubs opening across the country with our £25 million of investment, investing nearly £35 million over 3 years to improve maternity safety, on top of the extra £186 million already being invested each year, and of course the success of the HRT prepayment certificates and, as I've already referred to, the research into this very important issue of maternity disparities.
Thank you, Mr Speaker. House of Commons library figures reveal that 1 in 4 women with suspected breast cancer are waiting more than 2 weeks to see a specialist, and the waiting list for gynaecological treatments has risen by 40,000 in a year, which means there are now almost 600,000 women waiting. That's up a third over 2 years. Now, Labour has pledged to tackle this backlog so that more women are seen faster. How much pain, misery or worse do women have to endure before this government start prioritising their health?
As the Honourable Lady will know, she saw the statistics published very recently. In fact, we are treating more people at earlier stages of their cancer. But I want to take her on her point about gynaecological weights, because it's an important one. We are spending more than £8 billion this spending review period on additional elective activity, investing in additional capacity, including community diagnostic centres and surgical hubs, many of which provide gynaecological tests and procedures. And she may have missed it, but in the latest published management information for March, it shows that the longest waiters for gynaecology services have reduced by nearly 95% since their peak in September 21. Of course, there is more to do, but we are making progress, and I thank all of the doctors and teams who are involved in that important work.
Number 15, Mr Speaker.
Shannon, Minister, please.
Thank you, Mr Speaker. Today we've seen alarming figures pointing to the systematic deprioritisation of women's health in this country. 600,000 women in England waiting for gynaecological treatment, 33,000 women waiting more than a year, and under two-thirds of eligible women screened for breast cancer in the last 3 years. Will the Secretary of State come clean and admit that under this government, women's health has become an afterthought?
Absolute nonsense. As I say, I have prioritised women's health. I'm pretty sure I invited the Honourable Lady to the Women's Health Summit earlier this year. But I have, and she's very graciously saying I did. But the point is, I want women to receive the sorts of care that we would all hope and expect for them. And I've prioritised this precisely because there are conditions, including gynaecological conditions, that have not received the attention they deserve historically. As our Women's Health Ambassador, Dame Leslie Regan, says, the NHS was created by men for men, and I am the Health Secretary that is sorting that out.
Mr Speaker.
Mr Speaker, with permission, I'd like to take questions 15, 19 and 21 together. We are enormously grateful for the work of GPs in delivering 64 million more appointments nationally compared to 2019. Our primary care recovery plan enhances GP access by expanding community pharmacy services nationwide. 98% of community pharmacies have signed up to the Pharmacy First offer, with over 125,000 consultations claimed in the first month.
Thank you, Mr Speaker. Across Bedfordshire, we suffer from patient-to-GP ratios well in excess of the national average, with high housing growth simply not matched by GP capacity. At Leadsom, we've been able to break through 15 years of deadlock by putting stakeholders together, but issues still remain across the county. And from Shefford to Stondon, heartbreaking stories are commonplace. It's not ICB specific, it's an issue affecting people right across the country. So what more can we do to ensure areas of high housing growth with GP capacity residents deserve?
Well, the honourable gentleman raises a really important point. He may be aware that the Bedfordshire, Luton and Milton Keynes ICB received £36 million for their operational capital budget in 2023-24, with over £118 million for this spending review period. Now, that operational capital is core funding provided to ICBs to be able to deliver primary care, amongst other things. In addition to that, of course, he'll be aware that ICBs are able to provide input to planning permissions to ensure that there is primary care delivered where there are new housing developments. I have worked with other honourable friends across the House to tackle this issue, and I'm very happy to meet with him to discuss it further.
McCarthy.
Thank you, Mr Speaker. When I speak to my constituents in Brislington, they tell me they're having to wait inordinate time to get through to their GPs at the Brooklyn Health Centre on the phone, and even longer, over 2 weeks waiting for appointments. When I talk to constituents in fish ponds, they tell me they've been told it's over an hour wait for prescription medication at the local pharmacy there. And we all know what the situation is with dentists. The other thing my constituents are waiting for is a general election. Does the Minister agree with me that's the only way we're going to sort out these problems in our NHS?
Yeah. I certainly don't agree. I think that if Labour were in government, we would see significantly worse outcomes. COVID was a once-in-a-100-year pandemic, and we have pulled out all the stops to recover from that. And it is a huge tribute to all those working in primary care that they have done so well. And I would say to the Honourable Lady that in her ICB, Bristol, North Somerset and South Gloucestershire, that 38.4% of all appointments have been delivered on the same day they were booked in February this year, and 84% of them were delivered within 2 weeks of booking, with 66% of them face-to-face. These are extremely positive numbers for the 482,000 appointments delivered in February 2024. And what's really important is that patient care staff increased by 656 full-time equivalents since 2019.
Thank you, Mr. Speaker. I've listened to the Minister's comments, but the number of patients per GP is nearly 25% higher in the Bedfordshire, Luton and Milton Keynes area than the national average. So will the Minister explain why her government thinks it's a good idea to cut the proportion of doctors being trained as GPs from around 1 in 3 to around 1 in 4?
Well, the Honourable Lady is simply wrong. She will be aware that, in fact, our long-term workforce plan intends to raise the number of training places for GPs to 6,000 by 2031-32, and that, in fact, in 2022 we had over 4,000 new GPs applying to become to take training places, and that is an absolute record. There's much more to do, and I'm working with GPs on a Future for GP Practice task force to make sure that we do everything we can, including the 36,000 additional professionals now working in GP practices, to relieve the pressure on GPs and deliver much better patient access.
Thank you, Mr. Speaker. Last week, a constituent contacted me. Her teeth crumbled during pregnancy and she was unable to get a dentist appointment. Another constituent, in agony, desperately pleaded for help to find a dentist. My young son, Clifford, has been waiting 2 years for a tooth extraction. Hundreds of emails I've received similar. This is simply not good enough. What plans does the government have to sort out this once and for all? And what advice does the Minister have for my constituents?
My honourable friend raises an incredibly important point. We know that since all dentists were locked down during COVID, the recovery to access to NHS care has not been as fast as we would like. That's why we announced our dentistry recovery plan, including a new patient premium, which has already seen hundreds of thousands of new NHS patients who've not seen a dentist in 2 years since it was launched on March the 1st. We also have 240 dentists will receive golden hellos to encourage them to work in underserved areas. We also have our new Smile for Life prevention programme, which will ensure that babies in family hubs will receive that early dental check for their milk teeth. Pregnant mums will receive better dental care and advice. And what we are trying to do now is work with dentists to look at reform of the UDA contract. But in fact, at the first meeting of that group yesterday, it does seem that dentists feel all of the parameters are in place, and what we now need to do is to ensure that the incentives are there, and we're seeing things really changing rapidly.
Speaker, my GPs are working extraordinarily hard to increase access in the face of ever-increasing public demand, and I was alarmed by the Labour Party's to talk about scrapping the GP partnership model, as I find in the Stroud district that GP practices are some of the most efficient parts of our NHS services, Mr. Speaker. It is support, removal of bureaucracy and opening up funding pots that I think they need, not dismantling. Will my right honourable friend explain how access to primary care will not be helped by removing the partnership model, and what the government is doing to help ICBs create more flexible partnership funding pots?
My honourable friend makes a fantastic point. And I say again, GPs are absolutely underpinning our primary care. We all absolutely rely upon them. And our measures to create 36,000 additional roles in GP practices is to provide them with the additional capacity that they need so that they can serve their patients better. And that is good for patients, good for primary care, and incredibly good value for the taxpayer. And it is ludicrous that Labour are proposing to undermine the GP partnership model. That would be a disaster for primary care.
We now come to topicals. Mark Eastwood.
Mr. Speaker, we know that people in work lead happier, healthier lives. However, over 10 million not fit for work fit notes were issued last year. Most are repeat fit notes issued without any advice. So we are missing a golden opportunity to give millions of people the support they need to remain in work. That is why we are launching a reform of the fit note process to create a new system where fit note conversations focus on what people can do, not what they can't. And as part of this, the government will consider shifting the responsibility for issuing the fit note away from GPs to reduce the pressures they face and free up millions of appointments. I want to thank everyone who has delivered this vital work, and I very much look forward to hearing the results of this call for evidence in due course so that we can reform our welfare system for the sake of our constituents and our GPs.
Mark Eastwood.
Speaker, according to the Association of British Health Tech Industries, it takes on average 17 years for life-saving and enhancing technologies to be adopted in the NHS. What steps is my right honourable friend taking to ensure that the adoption of new technologies is sped up so the NHS can save more lives and improve patient outcomes?
If I may, I dispute the 17-year figure cited because it can vary across innovations and that figure is contested, but he raises a really important point. And we have a plan to prioritise accelerating patient access, ensuring safe, effective and innovative medical technology for patients and the NHS. Our ambition is backed by funding, and we are reforming the medtech regulatory framework. We are introducing the Innovative Devices Access Pathway Pilot, and we are launching frameworks to increase availability of innovative products for the sake of patients across England and the United Kingdom.
Shannon, Secretary of State, West Streeting.
Thank you, Mr. Speaker. The Health Secretary has promised that the government will provide an extra 2.5 million dental appointments this year. But the Dentistry Minister sat next to her says the figure has, and I quote, a high likelihood of not being reliable. So which one of them is wrong?
Delighted to be able to tell the honourable gentleman that, in fact, we modelled down the ambitions so that the figures we were initially provided with were higher than the 2.5 million appointments. But that's because we are focused on delivering this dental recovery plan and not overpromising. But the gentleman opposite finds it easy to call our children short and fat, but shies away from welfare reform, calling it shameless and irresponsible. He says he's ready to stand up to middle-class lefties, but Labour has never put patients first and condemned the unions who strike. And he makes glossy promises about reforming the NHS in England, yet Labour has failed completely with Labour...
Order. Can I just gently say, there's a lot of backbenchers who we need to get in. I'm sure both sides want to do that. West Streeting.
Thank you, Mr. Speaker. The last Labour government delivered the shortest waiting times and the highest patient satisfaction in history, a record her government can't even begin to touch. But back to dentistry. The Chief Dental Officer says the announcement is nowhere near enough. The British Dental Association says the recovery plan is not worthy of the name, won't stop the exodus of dentists and won't meet the government's target. So who should the public trust, and why should they trust the Health Secretary to deliver when her own adviser, her own minister and, crucially, dentists all say she's brushing the truth under the carpet?
Again, let's bring ourselves back up to date. I know the Labour Party likes looking back to the last time they found favour with the British public, but Wales is the up-to-date record for today. The lamentable record of Labour in running the NHS in Wales speaks for itself. And if the honourable gentleman is so set on reform, why on earth isn't he helping his Labour colleagues in Wales do exactly as he is promising? Because these are empty promises, and because the honourable gentleman, and I'm afraid the Labour Party, will step back from reform rather than grappling the issues such as we do with our recovery plans. And just finally, on the dental recovery plan, we have had already, within a month of the new patient premium being switched on, we have had hundreds of surgeries open to new patients, and that means patients in his constituency and elsewhere getting the care they need.
As my right honourable friend has already heard from our right honourable friend, the member for Whittam, the Mid and South Essex ICB has published proposals to close St Peter's Hospital in Malden and to relocate medical services elsewhere, despite the huge growth taking place in the town. I have to say to my right friend that my constituents have very little confidence in the consultation. Will she therefore look closely at the outcome and, if necessary, intervene to ensure that my constituents are still able to access vital health services locally within the town?
May I thank my right honourable friend for raising that. I understand that a consultation was conducted locally, and over 5,000 local people and staff responded. Their feedback will be analysed by an independent research agency who will produce a report for the Mid and South Essex ICB, and a meeting is due to take place in public in July. I will, of course, continue to take an interest in this matter.
SNP spokesperson Kirsty Blackman.
Thank you very much. The recent announcements on fit note reform are just the latest in a long string of attacks on the most vulnerable people in society, vilifying sick and disabled people, when, as the Joseph Rowntree Foundation points out, almost 2/3 of those living in destitution live with a chronic health condition or a disability. The UK government is continuing its track record in failing and making life more difficult for disabled people. Does the Minister understand, as the Secretary of State, understand how much more difficult these changes will make lives?
The reasons that these reforms are being brought forward is because we have seen a simply unsustainable rise in the number of people who are being who have been given these fit notes so that they cannot re-enter the world of work. We want to support people into work because we believe that this is the best way to help them recover, but also, of course, helps us fund the NHS, because indeed the NHS is funded by people who work and who pay their taxes. But again, I just draw the Honourable Lady's attention to matters a little closer to home. Sadly, Scotland's record on health is very, very difficult to read, including the worst level of drug deaths in Europe. And I would encourage her to concentrate on how the SNP is running health services in their local area.
Dr. Lisa Cameron.
Mr Speaker, and I refer the House to my register. The British Psychological Society have commended the benefit of government support for staff, mental health and wellbeing hubs, and they're keen to see this support continue. So can the Minister give an update on the support and progress being made for the vital issue of staff mental health and wellbeing?
Speaker, it's a very important point. We know how vital it is to support everyone who's working so hard in our NHS to support patients. NHS England are currently reviewing mental health services for all staff who need them to ensure that they can access the support they need. They're working collaboratively with regions and integrated care systems to agree the best approach to do this.
Thank you, Mr Speaker. There is an increasing incidence of bowel cancer amongst younger patients, like my constituent Emily, who received a late diagnosis after many months of attending her GP with iron deficiency anemia. Younger patients often report that bowel cancer was dismissed as a possibility by their GP due to their age, and that symptoms like iron deficiency anemia are not taken seriously enough and not included currently on the list of common symptoms on the NHS website. What is the Secretary of State doing to ensure that NHS guidelines and practice are fit for purpose for younger patients who far too often receive late diagnosis of bowel cancer?
Well, the Honourable Lady makes a very important point. As part of the NHS long-term plan, we have an ambition to diagnose all, 75% of all stageable cancers at stage 1 or stage 2 by 2028. That means on the harder to detect cancers, such as bowel cancer, we need to make significant improvements. We are working across systems to deliver those improvements, better screening programmes, but also improving patient pathways. But I'm more than happy to meet with the Honourable Lady if she wants to have a further conversation specifically about bowel cancer.
Thank you, Mr. Speaker. Following discussions with constituents living with Parkinson's and also discussions with Parkinson's UK, I'm concerned that in North Yorkshire we only have one dedicated Parkinson's nurse. So given the complexity of the condition, can my right honourable friend inform me of what steps are taken to further incentivise nurses to specialise in Parkinson's and also long-term delivery?
Makes a very important point. I know the huge value that Parkinson's nurses in my own constituency of Pendle make to local patients. The NHS long-term workforce plan, backed by over £2.4 billion over the next 5 years, sets out that the NHS will focus on expanding the number of clinicians who train to take up enhanced and advanced roles and work as part of multidisciplinary teams that have the right skills to meet the changing needs of patients.
Richard Burgon.
Thank you, Mr. Speaker. At the community coffee morning at the Compton Centre in Leeds yesterday, the main issue that residents raised was the difficulty in getting access to dentists. Now, the Secretary of State has struggled to give any credible answer on this question today. So, is she aware of the Daily Mirror's Dentists for All campaign, and will she back it? The three demands being everyone should have access to an NHS dentist, restore funding for dental services and recruit more NHS dentists, and change the contracts because they're simply not fit for purpose. Does the Secretary of State agree? And if not, why not?
Because we have our fully funded dental recovery plan, and in case he wasn't listening carefully earlier on, it's switched on the 1st of March, and nearly 500 more practices in England are accepting new adult patients compared to the end of January. But there is even more under the dental recovery plan. We have plans to bring in new dental vans to help our most isolated communities, and we are also bringing in the Smile programme, Smile for Life programme for children, because prevention must be a critical part of our dental recovery plan.
Chair of the Select Committee, Steve Bryan.
Ministers will be aware of a rather boastful claim last weekend by the makers of Ilford and Lost Mary vapes. They've already launched rechargeable, refillable products which have a coil in each pod, so they're not by definition single-use or disposable according to the published regulations. Can the Minister reassure the House and parents they're alive to this and they will pivot as necessary now the bill goes into committee?
May I thank my honourable friend for raising this, and it shows the cynicism with which the tobacco and vaping industry is approaching these landmark public health reforms. In relation to vapes, we have committed to consulting on the powers that we are adopting in the bill, precisely because we want to ensure that the regulations, when they come to the fore, meet the realities of the market, the cynicism of those companies behind the market, and helps to ensure that our children do not continue to have these horrible items plied to them in order to get them hooked on nicotine.
Lee Anderson.
Thank you, Mr. Speaker. I was disappointed to see the chair of my local hospital trust and the East Midlands Labour mayoral candidate use my hospital as a political campaign prop by inviting the Shadow Health Secretary and the Leader of Opposition to canvass patients and staff. So can the Minister please explain to me how we can rein in this type of gutter politics and prevent my local hospital being used for Labour's dog whistle politics?
If I may, this is, I think, a very serious matter. I have raised this with the Chief Executive of NHS England and asked her to raise this with the Regional Director and Nottinghamshire Integrated Care Board. The reason for this being that we believe this may be a breach of the Nolan Principles.
Speaker, just yesterday the ONS released data showing alcohol-specific deaths in 2022 were 4.2% higher than in 2021 and a massive 32.8% higher than in 2019. Will my right honourable friend now seriously consider a standalone alcohol strategy based on this worrying trend and agree to meet with myself and other interested parties to discuss a way forward to tackle alcohol-specific deaths?
My honourable friend was an incredibly hard-working health minister, and I pay tribute to her for all she did in this area. She'll be aware that our groundbreaking drug and alcohol strategy commits over £500 million of new funding over the spending review period to rebuild drug and alcohol treatment services, with plans to get an additional 15,000 alcohol-dependent people into substance misuse treatment by 24-25, which we are currently on track to achieve. I'd be delighted to meet with her to talk about it further.
Ruth Gabriel.
Thank you, Mr. Speaker. A young woman came to my last surgery telling me that the delay in her GP diagnosing her ovarian cancer, she is now infertile and receiving aggressive treatment. She had made 4 GP appointments over several months with unexplained stomach cramps, and only an emergency admission in another country was the ovarian cancer diagnosed and the tumour removed. How long will it take until the symptoms of female-specific conditions are taken seriously by our medical establishment from initial training onwards?
May I thank the Honourable Lady for raising this and very, very much send our best wishes to her constituent. She raises, I think, a really important point. The symptoms that women can experience are very different often for conditions not just relating to cancer, but also, for example, heart attacks. And part of my prioritisation of women's health is to get that message out to clinicians so that they are able to make the best and the most prompt diagnosis they can for all women, as sadly her case has demonstrated so very, very tragically.
Hancock.
Thanks very much, Mr. Speaker. What's the Secretary of State doing to make sure that the UK Health Security Agency has the budget and the capabilities that it needs? The recent expansion of bird flu amongst mammals in the United States is a salutary lesson. Thankfully, there is no signs yet of human-to-human transmission, but it reminds us of the incredible value and importance of being vigilant in this space and having the best possible technology ready to respond as soon as possible.
Well, may I thank my right honourable friend for his question and, of course, for his integral role, not just during the pandemic, but also in setting up the UK HSA. He will understand that I and others are keeping this under very, very close review, and the Chief Medical Officer is briefing me as and when is needed.
Alison Thewlis.
Mr. Speaker, I've had concerns raised about a company based in England but operating across the UK online. It shapeshifts and is known variously as Young Vibes, Peaky Parents, Cactus Kids, The Mumsnet and currently Anxiety Recover. They offer to fix children's anxiety in mere weeks, but they're preying on vulnerable families, drawing them into expensive treatments and inciting them to take out loans and get into debt. They're operating outside of regulatory frameworks, so can I ask what ministers can do about such unscrupulous and exploitative companies?
The Honourable Lady raises an important point. I would ask her to write to me, please, with that, so we can look into it.
Will Quinns.
Given the importance of the UK's life sciences sector, could my right honourable friend update the House on progress on commercial clinical trial recruitment?
Thanks in part to the sterling work of the Honourable Member, monthly average patient recruitment into commercial clinical trials is almost 5 times the figure it was back in June 2023. This is hugely positive, but there is clearly more to do in this space.
Bel Rivera Ade.
Mr. Speaker, for over a decade, the Camberwell Dialysis Unit has provided high-quality NHS care to patients in South London. So my constituents were shocked to hear that these services are to be outsourced to Divernum, a multinational for-profit health corporation that has already had one of its clinics rated inadequate and put into special measures. Does the Minister accept that privatising the NHS bit by bit has disastrous implications for care? And will he listen to patients in my constituency and commit to maintaining our NHS dialysis provision?
Well, Mr. Speaker, as usual, this sums up the contradiction in the Labour Party between the front bench and the back bench on privatisation. But any service changes should be based on clear evidence that they will deliver better patient outcomes. Within Lambeth, patients who will receive dialysis at the new site in Brixton will receive care in a significantly improved environment with brand new facilities in a great example of an innovative public-private partnership. And NHS England has established the Renal Services Transformation Programme to reduce unwarranted variation in the quality of access to renal care.
Stephen Metcalfe.
Thank you, Mr. Speaker. Will my right honourable friend join me in recognising the good work that Essex Partnership University NHS Trust have been doing to improve mental health outcomes, including the creation of a 24/7 pioneering urgent mental health care centre, providing urgent help when it's needed. Could this well be a model that could be rolled out across the country to improve access to mental health for all?
Well, my honourable friend rightly flags the excellent work that is going on to improve access to mental health services across the country. Last year, 3.6 million people got mental health support. That's an increase of around 30% in just 3 years, supported by record funding of over £16 billion into mental health care.
Steve MacDonald.
Mr. Speaker, mandatory fortification of flour with folic acid could save many thousands of children from spina bifida. So why is it happening so slowly at such a low level and applied to too few products?
Well, I can assure the honourable member that we remain firmly committed to mandatory fortification of flour with folic acid. This will help to protect around 200 babies each year from being born with neural tube defects. The policy is being delivered across the UK as part of the wider review of the bread and flour regulations. In January, we published our consultation response and will bring forward legislation to implement the policy later this year.
Yeah. Still a priest, sir.
Thank you, Mr. Speaker. 10 days ago, I went to the Whipps Cross A&E department to see for myself the pressures that the brilliant team there are under. Pressures which are heavily exacerbated by the failure to redevelop the hospital. Now, we were promised that the new hospital would be open originally by 2026. We are still in a position where there hasn't been agreed with the Department of Health the plan and timetable to even submit to the Treasury for that redevelopment. As a result, the hospital is having to spend huge amounts of money trying to stem the damage and being able to treat patients. So it's costing us all. For the sake of patient care and NHS budgets, will the Minister meet with me to work out where the hold-up is in getting Whipps Cross redeveloped?
Well, the honourable member raises the performance of her A&E department in her local hospital. I've worked closely with the NHS over the last year to improve the performance of urgent and emergency care. One thing we've seen is ambulance response times improved by over a quarter since this time last year, and waits in A&E have been cut. But I'm also very happy to meet with her to talk about her specific A&E department.
May I thank again the Secretary of State for visiting Watford General Hospital earlier this year, where we share the exciting plans for the new hospital with to do preparation work starting this year and construction starting by the end of 2026. As an update, I'm pleased to say I spoke with the West Herts Trust leadership team this week, who confirmed they are on track for that delivery within those timescales. So would my right honourable friend please join me in thanking them for their hard work in doing this?
I would be delighted to join him and to thank him again for the really positive visit to his local hospital. This is a great example, if I may say so, of a local MP working in his local area for his constituents and, what is more, delivering for them.
Greg Smith.
Mr. Speaker, as a practical measure to improve radiotherapy waiting times, will my right honourable friend agree to further work on the radiotherapy data set to include the collection of data on delays at each stage of the radiotherapy pathway and by tumour type to better understand pinch points in services?
We are working to improve radiotherapy services across the NHS, and I'd be happy to meet with my honourable friend to discuss this in more detail.
Final question, Daisy Cooper.
Thank you, Mr. Speaker. West Hertfordshire Hospital Trust is at the front of the queue for the new hospital programme. We have the land, the planning permission, the building design, the political support, the staff support and enabling works are underway. But the Hospital Trust, like many other trusts around the country, are being asked to submit business case after business case after business case. Can ministers please clarify whether these delays are down to bureaucracy in the new hospital programme, or are they deliberate delaying tactics by a government which does not want to release funds for hospitals before the general election?
Nonsense.
Mr. Speaker, normally a Secretary of State would appear at the dispatch box with a question like that and say, I refer the honourable member to the answer I gave earlier. On this occasion, I'm going to refer the honourable member to the question from the Member of Parliament for Watford, because he has just set out the business case for Watford General, which is great news, and I would hope that she will be joining him and me in welcoming that new hospital when it is open.
Right, that completes questions.